Hi, everyone, and thank you for joining us today for the fourth seminar of Youth Medical Society, also known as YMS. My name is Akash Murali, and I'm the president of YMS. Also with me today are our officers, who you'll hear from a little later today. And a little bit of background, YMS is focused on providing high school students with an interest in medicine, access to expert medical professionals. And today, we'll be having Aryan take charge of the meeting as he found us an orthopedic surgeon to talk to. So I'll give it to Aryan.
Hi everyone, my name is Aryan Shipada and I am one of the website directors of YMS. Our guest today is Dr. Sai Devana. He is an orthopedic surgery resident doing a year research fellowship at UCLA. He is a Washington High School alumni in the graduating class of 2009. Dr. Devana completed both his undergraduate studies and medical school at UCLA, as well as general surgery internship and orthopedic surgery residency at the David Geffen School of Medicine at UCLA. Dr. Devana has worked on 5 published papers and has received over 10 awards and grants. Today, he will let us in on the life and actions of an orthopedic surgeon. Now he will provide some introductory remarks followed by a Q&A session. Dr. Devana, can you please start by telling us a little bit about your childhood, where you grew up, and what experiences or conditions influenced you in making your decision to pursue a career in medicine?
Right. Hopefully everyone can hear me. Thanks for having me. This is really awesome you guys are doing this. So my background is kind of all over the place, but I grew up in India, moved to the States when I was 11, and went to middle school at Centerville, which I'm sure all of you know, and high school at Washington. I had no interest in any sort of like science, STEM, anything in high school. I just kind of got through. I ended up at UCLA because of tennis, actually. And my freshman year at college, I realized that tennis wasn't really going to be a career where I can, live comfortably and make something of myself. So I started kind of like poking around, looking at different opportunities. And right around that time, I actually injured myself. I sprained my MCL. So I ended up seeing Dr. Sharon Haim, who's an orthopedic surgeon that I still work with to this day. And she was the team doc for the tennis team and most of the teams in general at UCLA. So just sitting in our clinic, I was like looking around and I was like, wow, this person does surgery. They work with athletes. And at that time, UCLA wasn't covering the Lakers, but there was a lot of like different basketball players around. And so sports was like a big influence for me. And it just seemed like pretty cool that I could mix medicine with sports. So from that point on, I kind of started looking into how to get into med school. So I was kind of late to the game, but, like they say, it's never too late. I started doing some research, made sure my grades were okay, and somehow ended up in med school. So that was kind of how I got into medicine. As far as orthopedics, like I said, it kind of sparked when I first was on the patient side of things. But as I kind of went through med school, I went in with an open mind, which is really important because there's so many different specialties and subspecialties within medicine that it's a little overwhelming and you don't want to close off any doors too early. And I ended up liking, honestly, most things. But surgery was on a total different level for me, like just being in the OR, the adrenaline, the kind of responsibility that you have, the variability, the day-to-day stresses. I kind of liked all of that. And picking ortho between other surgery specialties honestly came down to, for those of you who may not know, and it's okay if you don't, orthopedics deals with the musculoskeletal system. So a lot of people, like when they see me, they're like, oh, you're a foot doctor, but that's not actually true. So ortho, basically we operate all over the body, pretty much any bone in the body below the head we operate on. So ortho primarily involves the musculoskeletal system, as I said, and we take care of like trauma, so any bad car, motorcycle accidents, any broken bones, torn muscles, ligaments, tendons. So that's where the sports medicine aspect comes in. We do joint replacement, which is like the most successful medical intervention out there right now. And then there are other specialties like foot and ankle, spine, we do spine. So ortho kind of is all over the body. And what I quickly realized in medical school is that bones heal. And so you can, see a lady that's 75 years old come in completely debilitated on her deathbed because she can't walk from a broken hip, and we fix the hip and they're walking the next day. So that was kind of what drew me to ortho, is that patients do really well in your clinics. Everyone's really happy for the most part because bones heal. So that's kind of how I ended up in ortho. And as far as why I'm still at UCLA, so I moved to LA in 2009 for undergrad, and I just could not leave. Like, obviously, UCLA has its name and everything, but just the Southern California environment, the weather, and the opportunities here are pretty great. So I just never left. So I've been here for 12 years, but that's pretty much the background of my journey through medicine.
Thank you.
Okay. I appreciate that little bio that we got from you. So what we're gonna do now is I'm going to invite some of the officers of our club to pose some questions. And if each of you guys could just introduce yourself by name and title and ask your question, that would be amazing. Akarsh, let's start with you.
Hi, Dr. Devana. My name is Akarsh, and I'm the other website director here. And my question is, are there any experiences going through medical school or throughout your career that stood out as key learning moments?
Hey, Akarsh, thanks for that question. This is like a very good question, and something that I feel like I've been asked many times through all the various interviews and stuff you end up going through eventually. It's hard for me to pinpoint like very specific experiences, but the first things that come to mind are, so medical school, it's 4 years in most places, and the first 2 years is kind of classroom setting, and then the second 2 years is clinical, where you're in the hospital in the thick of things. I can remember my third year, my first day on ICU, there was a mass casualty event. And so what that basically means is, a bunch of people came to the hospital kind of in a critical situation. And me, as a fresh third-year medical student who's barely done any sort of hands-on work, all of a sudden they're like, "Oh, do you know how to intubate a patient?" I was like, "No, and I've never done it." And they're like, "Well, you have no choice. Just YouTube it and get in there." So, it's like, obviously those kind of experiences you hear about and you're like, well, that, there is some guidance, and there's obviously people around you that, are making sure you're doing things well. But the biggest thing that taught me in medicine is that up until that point, someone had told me like what to study, what to do, what to, achieve, like what my goals are and how to get to them. But once you enter medicine, it's kind of not the same anymore. It's kind of, you kind of have to go out of your way to, one, get out of your comfort zone, and two, pursue what you want to learn. Because honestly, the field itself is like drinking water from a fire hose. Like, there's just so much that you're never gonna conquer it or learn it all. But if you are able to get out of your comfort zone and also just like set your own goals and kind of lead your own way, then that's kind of where medicine becomes fulfilling. And I learned that pretty early on in third year, when I was kind of thrown into things, and every day I was overwhelmed. I was so stressed. I like woke up like, oh my God, like what am I gonna have to do today? But eventually you start to figure out that, that's what makes this exciting. So that's kind of it.
Thank you.
Hi, Dr. Devana. My name's Ashley. I am one of the publicity directors here at YMS. My question for you today is, has your career been exactly as you expected, and have you faced any surprises that changed your perception in the field?
Good question. It has not been as I expected. It's kind of one of those things, like when you're in third grade and you talk to somebody that just finished fourth grade, they tell you, "Oh my God, fourth grade was the hardest thing I've ever done. Like you don't know what you're in for," kind of thing. So every stage of the way, I kept thinking the next part is going to be the hardest part, and I'm not going to get through it. And a lot of people talk about this once you get into medicine, but I think I wish someone told me about this beforehand, because it's really important to go into it knowing that you're going to feel a little overwhelmed, and you're going to feel the whole imposter syndrome. And what that is basically you're always wondering like how you even made it here, like, do you even belong? And that's something that's kind of prevalent throughout the experience and the process. And I wish someone had told me that going into it. So that part I definitely did not expect. But as far as the actual course of things, medicine is nice in that, like, everything's kind of laid out for you. Like, you go to 4 years of undergrad, you do your pre-medical courses, you take the MCAT, you apply to med school, and so everything's kind of laid out for you. But what's really cool is that along the way, I've met people that, took 10 years off after college and then somehow made it into medicine. And so I think the most unexpected thing for me is that there's just so many different paths to where you want to be ultimately as a surgeon or a general practitioner or a hospitalist or whatever it is, that at some point you just have to like really look at yourself and stop worrying about what other people tell you about how hard things are or how impossible it is. So, but otherwise, I think everything else has gone, I guess, well so far. But and the other thing is, I guess, that was unexpected is this year. So I'm currently an orthopedic resident, which orthopedics itself is a 5-year residency, but a lot of sort of higher tier programs have a research year built in where some of the residents can do a research year. And so I ended up doing a research year, mostly because I randomly fell onto some opportunities. And my wife's currently in New York doing a fellowship for a year. So that kind of threw my plan a little off track because I was like, oh, I'm never taking a year to do just research, but it's actually been really fulfilling and productive. And it's kind of nice to have my life back for a year. So, but yeah, that's the underlying message, is that there's no one path. And so don't have any expectations of what it's going to be like going in.
Thank you.
Yep.
All right. Hi, my name is Adrian. I'm the secretary of the club. My question for you is, what does a typical day look like for you? And what are some things you enjoy and some things that you don't like as much?
So it's very variable. I guess I'll, as a resident, as a clinical resident, as you progress through, so as an intern, you're pretty much in the hospital, a lot. And again, it's so variable depending on what field you do. But in terms of orthopedics, as an intern, you're probably working about 80 hours a week. You're in the hospital at 4 or 5 a.m., getting all the numbers and checking in on your patients. And then you round on your patients. And then, you just kind of are helpful wherever you can be. And you take care of the people that are admitted to the hospital. As a second-year resident, that's when things get a little crazy. You're pretty much living in the hospital for a year. It was definitely one of the hardest years of my life, but the most fulfilling. As a second year, you essentially are there with the intern in the morning, but when the intern leaves, you're still there doing surgeries, and you're considered the consult resident. So anything that comes into the hospital that requires an orthopedic consultation, so any broken bone, anything where the doctors need an orthopedic surgeon to evaluate, they'll call you. So you're basically on call. And that, again, it varies, but usually you're on call about 30 hours straight, every third day. So you have like a post-call day and then a normal day after that. All that's to say is you're really busy. And you start to question things, and that's one of the main reasons why I even took this research year, because second year kind of wore me down a little bit, and that's normal and that's expected. But that's kind of what you sign up for with most surgery specialties. Is it gets pretty brutal in terms of work hours. And right now, as a research resident, it's kind of funny because up until now, all my research has been kind of like basic science. And this year I completely did a 180, and I'm doing mostly like computer-based machine learning research. And so I work from home, and as you can see, that's where I am right now. And my hours are like great. Like I work kind of when I need to. And a lot of it is just kind of overseeing projects and things like that. So right now life is good. I'm not working too much, but in general, if you're going to go into a surgical specialty, you're preparing yourself for a few years of a lot of work.
All right, thank you.
Yeah.
Hello, my name is Archie, and I'm the treasurer. And my question is, what have been the critical milestones in your career, and are there things you still want to achieve?
I don't know. I think just like every stage where you get into college, then get into med school, then get into residency is kind of like a milestone. In each stage, you're stressed out. You're like, there's so many different things going in. But I think looking back, one of the biggest things that I feel really changed my trajectory was, in med school, when you start out, everyone talks about, research, and like you have to do X amount of research, you have to have X amount of publications. And so that was like a big stressful factor for me. And I decided to do basic science research, which is I studied basically perivascular stem cells and their ability to regenerate or heal an Achilles tendon in an acute rupture setting. And everyone was like, you know what, that's a terrible idea, because doing basic science research involves you spending hours and hours in lab, which in med school, you're already worried about classes and all that. So, and even with all that work, you still might not get a publication, because basic science is the nature of it is just that. But I was really interested in it. I found it very fascinating. So I just went after it, even though I knew it was a big risk. And I actually didn't end up getting a publication for it until I got into residency. And so when I interviewed for orthopedic residencies in general, I interviewed against people who had like 20, 30 publications just doing like database research. But all of my interviewers were very, very interested in my project, because I had spent so much time and I had known so much about the subject itself, that I think that's when I realized like quality does matter over quantity. And so I think that was really a good big changing point for my career itself. Even though it's technically not a milestone, I think that's what I would consider a big milestone for me. And in terms of the second part of your question, in terms of what I hope to achieve, I don't know, honestly. Like at this point, I'm just trying to survive residency. And I think that's kind of what like most residents will tell you. But I am very interested in kind of global outreach. And UCLA is affiliated with a lot of global partners, especially in some African countries. And so with orthopedics kind of being a big implant sort of specialty, I would want to one day go into some sort of implant sustainability research and try to somehow get these implants that we have in America that we kind of take granted for, to be honest, to some of these countries that don't even have access to them. So that's kind of overall bigger picture for me, is be more helpful in the world, I guess.
All right, thank you.
Hi, I'm Tumin, and I'm one of the publicity directors here at YMS. And I have a couple questions for you, so feel free to ask me to repeat myself.
Sure.
But the first question is, what are some of the specific diseases or disorders you have worked with?
Yeah, so in undergrad, my research was studying this protein called oncomodulin, which was first discovered in various oncogenic tumors, cancer tumors. And what's interesting about it is that it's also found in inner hair cells of your ear. And so I was able to study that protein, and I majored in molecular bio and math in undergrad. So my interest was molecular bio. So I was able to study this protein and basically characterize its function within the inner ear. And we were able to show that it's responsible for acute early onset age-related hearing loss. So it was just kind of interesting to me at the time that a protein that's found upregulated or overexpressed in a tumor is also found in your inner ear. So I thought that was cool, but obviously that had nothing to do with ortho. So when I got into medical school, as I was kind of getting into earlier, it was right around the time that Kobe Bryant had his Achilles injury. And so I was working in a lab, and we were working with perivascular stem cells, which are stem cells that are around blood vessels. And the idea is that when you get injured or have any sort of musculoskeletal injury, these stem cells are recruited and they're right next to the blood vessels, so they can just hop into the bloodstream and go to wherever they're needed to then help with the regeneration and healing process. So I had the idea of, if we built a model to simulate an Achilles tendon rupture in a rat, then can we take these perivascular stem cells from the fat, because fat also has blood vessels. And so can we isolate these stem cells and inject them directly into the injury site and see if the healing process is better than the control, which is not injecting anything. And what we found was that these tendons, biomechanically and histologically, so we tested them using this like special machine and looked at them under the microscope, and both showed a significant improvement. And so the idea long-term with that is that, if you're able to isolate these cells from fat, then theoretically, if someone came in, you can just, take some fat from their abdomen or wherever, spin it down, get the cells you want, and inject their injury. And, if that helps in the healing process, then great. Then that's something else that we've discovered. So that was a really exciting project for me. And obviously, with research like that, it takes a long time to get to the human stage. And I still think that we're several years away from that, but I think that was a good launching pad into several other projects. So yeah, that's kind of my research in med school. And then in residency now, so what I'm working on this year is essentially I'm trying to build predictive models of surgical outcomes. So to kind of put it in a simple way, if someone has a total knee replacement, I'm trying to build a calculator that you can just plug in their various comorbidities. So if they have diabetes, if they're 72 versus 65, if they're male or female, if they have heart disease, you plug in all that, and then the app spits out a number of, let's say, this person has a 7% chance of a complication or 7% chance of readmission. And so essentially what I'm doing is using various machine learning techniques and models to build this predictive model and try to optimize it. And so far we've got a couple of pilot studies for total knee and total hip replacement, and we're trying to kind of expand that throughout the orthopedic literature. So yeah, I think so far it's going okay, but we just need more time to kind of build these models.
Thank you. And your next question would be, what are the major breakthroughs in the field that you are looking forward to, and how would you like to see the field change in the coming years?
Ooh, major breakthroughs. I think right now, one of the more exciting things is kind of using this black box that we call machine learning and try to figure out various models to predict something. And so other fields of medicine have used this very robustly. Like there's a lot of research in cardiac, in the cardiac world, as well as other sort of chronic diseases. And so I think one of the breakthroughs I'm looking forward to, and also currently working towards, is trying to get that sort of predictive capability within orthopedics. Because if we can predict complications with surgeries, we're talking about saving billions of dollars and saving a lot of people a lot of misery. So while orthopedics is a very, very successful field in terms of how patients do, the complications that we do have can turn into absolute disasters. So one breakthrough is to figure out how to predict these and how to reduce them. And overall, I think, the translational world of research right now is like so booming with so many different things. Whether it was stem cell research that I was involved in or PRP, there's just a lot of things that go into preventative medicine that I think hopefully eventually will reduce the amount of people that even end up in an orthopedic surgeon's office. But we'll see what happens. There's just a lot going on, I feel like. So that's why I picked one very small sort of field in machine learning, but I think there's a lot of exciting stuff on the horizon too. So we'll see.
Thank you.
Yeah.
Hi, my name is Rahul Ganturi. I'm the VP of YMS. My question to you was, are there any suggestions or pieces of advice that you can offer to those that plan to pursue a career in medicine, or specific remarks that you can offer to students interested in your specific field?
Yeah. So as far as medicine goes, obviously at this stage, I'm assuming everyone here is in high school. At this stage, the biggest goal would be to, get into a good college. But that being said, there's so many myths out there that my biggest advice is be really careful who you listen to. There's a lot of people with a lot of wrong advice. But what you need to know is that like I said before, there's no one single path. You can go to community college and go to, finish up your degree at a undergraduate institution and get into med school. You can go straight to an undergraduate institution and get into med school. You can go abroad and do your undergrad somewhere else and get into med school. You can take 10 years off and, work in finance or start your own company and then end up in med school. So there's a lot of different pathways to how to get into med school. And I'm sure plenty of people will say this all the time, but I found it to be truly kind of what shaped my career is follow what you're passionate about and not what people tell you to do, because ultimately that'll get you the results that you need to kind of separate yourself from the rest of the crowd. And as far as getting into orthopedics, I think it's no secret that orthopedics is definitely one of the more competitive residencies to get into. A lot of people go unmatched every year. I think that the biggest thing to kind of keep in mind with that is, as you're going through med school, really try to establish what you're interested in and try to figure out early what you want to go into, because the earlier you know what you're interested in, the sooner you can kind of create your own path and create a plan. Because at the end of the day, especially now with more of these tests not counting anymore, I heard the MCAT isn't going to count soon or something. And step one, which is one of our board exams, is soon going to be pass fail. It's really important to show your kind of value in other places like research. And so the sooner you know, the more you can get involved. So that would be another thing I would say. And lastly, I think for me, the hardest part was, like I said, the whole imposter syndrome and how to deal with that. And like I said, it's very prevalent throughout, and I think a lot of people feel it. So it's really, really, really important to take care of yourself. So work out, do what, keep your hobbies up. If you like sports, play sports. If you like instruments, play instruments. If you like, hanging out with friends, do that. If you like traveling, do that. You absolutely have to make time for what makes you happy, because it's really easy to get lost in just working 100 hours a week and not really caring for yourself. And that's how you get burnt out. So you have if you guys are interested in medicine, you have a very long process ahead of you. So you have to make sure you take care of yourself during that process.
Thank you.
Okay. Now before we move on to the member Q&A, I had one last question.
Yeah.
And it was, if you could tell us about the impact COVID-19 has had on your work, and has it affected your research in any way?
Yeah. So I was in the thick of things right when COVID started. I was a second year consult resident. And we were getting, all these crazy traumas, and no one really knew at that time, should we, protect ourselves while we intubate this patient? There's blood flying everywhere. What should we do? Pretty soon after that, I'd say in mid-March, UCLA, our department kind of went into a skeletal system where instead of having multiple residents at different hospitals on different services, we kind of had like 3 residents running everything. And if things got overwhelming, people would get called in. And so for about a month and a half, I want to say, we canceled all elective cases. So elective cases in orthopedics mean, or in any surgical specialty, mean things that aren't urgent or emergent. So for example, someone that needs a hip replacement, it's not necessarily urgent or emergent. So we canceled those sort of cases for about a month and a half. And just took care of any acute things. And obviously in orthopedics, we see all of the trauma, right? So those still came in, and we definitely were busy with that. So from that sense, it didn't really change much. And people still were out driving, people were still out doing crazy stuff and getting injured. So that experience didn't change much, but our elective cases got canceled. So those kind of got delayed. Currently, most of our so other than that, our we have weekly education and conferences that used to be in person. Now they've completely changed to Zoom, which is kind of nice. And overall, I think now we're starting to, between all the different surges, I think we've kind of come back down. So UCLA at least is operating kind of normally at this point in terms of surgeries. I'm obviously not as involved this year because I'm a research resident, but I've kind of been, there as a backup if someone gets sick or, whatever happens. If they need extra help, they'll call me. And like I said, most of my research is on a computer, so I can really work from anywhere. So that's kind of nice from that end. But luckily or unluckily, I don't know what you want to call it, but orthopedics in general is sort of COVID proof in that people are still going to get hurt. People are still going to break bones. So we're still going to be in business and we're still going to be operating. So that part really hasn't changed.
Thank you. I appreciate it. So what we're going to do now is open up the Q&A to all members. And if you guys have any questions, go ahead and raise your hand and I'll call on you so you can ask it to Dr. Devana.
It can be questions about anything too. Don't feel pressured to ask only about ortho. I'm happy to answer questions about college and stuff too. And everyone should go to UCLA because it's the best school, FYI.
How did you decide what kind of college you wanted to go to? Was it like the campus, like the place, or something like that?
That's kind of a interesting thing for me. Honestly, I visited UCLA and absolutely fell in love with the campus, with SoCal, the weather. And at that time I was just deciding on what the best opportunity for me in terms of tennis would be. So I was basically down to UCLA and Berkeley, and UCLA just was a better fit. But looking back, I wouldn't do anything differently for sure. And obviously, like, I've been here forever, so I have a very biased opinion of UCLA, but take that for what it is.
Of course.
Sorry if you already answered this, but like you mentioned, you do research and medicine. Do you do that at the same time or like in different years?
You mean in medical school?
Yeah. So like when do you do research and when do you go to medical school?
Yeah. So again, there's different ways of doing it. Everyone has a break between the summer between their first and second year of medical school. That's when most people do the majority of their research, or like at least get things started. And then you can obviously do research as school goes on. It's harder to do, and that's one of the main reasons people thought I was crazy for doing basic science, because you have to be in the lab. So I'd be in the lab at like 1, 2 a.m. sometimes, like working with these rats. But a lot of people now, especially if you're going into things like ortho, derm, plastics, the more competitive fields, a lot of people take a research year between their second and third year of med school. Some do between third and fourth year too. But a lot of people just do research as kind of school is going, just whenever they have free time. And I will say the majority of people do kind of data set clinical research, which you can do anywhere. You know, you just need your computer, you need to crunch some numbers. So it really depends on kind of what kind of research you're interested in. If you're interested in basic science, then you definitely could consider an MD PhD, where you have 4 years or 3 years between, after second year of med school to do an outright dissertation. Or you can take a year off between your second and third year of medical school and do a full research year.
Thanks.
Yeah.
Tumin.
Hi, what classes and programs did you participate in high school, and how did they set you up for success in college and med school?
Wow, it was a long time ago. Honestly, I don't remember being in any program in high school other than sports. I played tennis, basketball, and I did cross country one of the years. Yeah, I don't think I was in any programs. I was just like so focused on sports at the time. I did take a lot of I was not very academically inclined in high school. I just kind of like did the bare minimum and got through, just because my priorities were different at the time. But yeah, I don't remember any. There definitely weren't like awesome groups that you guys seem to have now, like YMS and stuff, that would prepare someone for med school or even STEM fields. But that's why I said it's really great that you guys are doing this. Like, I would have loved to have something like this when I was in high school.
Thank you.
Yeah, so I also had a question. It's just like, so what's your thought process on when you're solving problems or you're trying to create solutions to problems in general in medicine?
In medicine?
Yeah.
I mean, that's a tough question to answer. I guess that my thought process, or a generic thought process, would be you have to have a primary outcome in mind that you want to either prove or disprove, right? Like it's like any other sort of scientific method. But with medicine in particular, I think the biggest thing to remember, and something that I've learned over the years, is just because you have a solution that may seem better on paper doesn't mean it's actually better. So you have to really sort of understand how to read a research paper, right? So a lot of people it's like marketing. They try to put words so that whatever their findings are seem like, the next best thing since sliced bread. But if you actually look at the statistics, or if you look at their methods, you realize, well, it's actually not what they claim it is, or to the extent that they claim it is. So a lot of like problem solving involves actually thinking about the end result and whether it's clinically significant or not, because you may prove that A is better than B by 0.2%, but is 0.2% clinically relevant? Like, maybe A costs $10,000 and B costs $2. Like, is that 0.2% relevant to that much of a price difference? So those are the kind of things that like you start to think about once you start getting more clinically involved. Is the end outcome is not what's on paper, but it's the patient in front of you and how they're going to be affected by it. I don't know if that answered your question, but
yeah, I think it did. At least on like on like a general scale. Yeah, appreciate it. If there are any other questions. Oh yeah, Mr. Chow.
From a teacher's perspective, right? So every once in a while I'm teaching my classes, we do our dissection. There are kids who are just freaked out, grossed out by these things, and I was just wondering, for medical students, is there some point at which students start to kind of, wow, this is really real? They have trouble dealing with like cadavers or even like fluids from patients and whatnot. Is it something everybody has to go through, or is it like, or most people go through at some point having difficulty dealing with, things with that, grossing out basically?
Yeah, that's actually a really, really good question. I think that's something, the goriness of dealing with medicine is, I think, what diverts people a lot. But I will say from my personal experience, literally our first lab of med school, we had 2 people faint. A lot of people like couldn't tolerate it. So it's not that you have to be like born to be okay with it. Like, most of us actually, even to this day, there's certain things that happen that I'm like, oh, I need a second to kind of regather myself. And I think that's basic human nature. And a lot of people do go through that in med school. And that's why the first 2 years are sort of developed that way, in that they're primarily classroom setting where, we're in the classroom most of the time, but then we have these labs where we get exposed to cadavers, to different clinical situations. But yeah, I don't want that to, dissuade anyone from going into medicine, because everyone deals with it. And it's human nature. Like if you see something gross, you're going to be grossed out. Like that's just, but at the end of the day, like I said, you just got to keep in mind, like you're trying to help this person. And over time you do build a tolerance to it for sure.
Any other questions before we start to wrap things up? Okay, sounds good. So we'll start closing things up today. So I just wanted to thank everyone for joining today. And most importantly, thank you, Dr. Devana, for making the time in your busy schedule to give us a glimpse into the life of an orthopedic surgeon. Our membership was interested in your area of expertise, and we are honored to hear from you and benefit from your experience. Your career trajectory working in orthopedic surgery shows a unique perspective in the field, and I know you have inspired many of us to learn more, myself included. I also wanted to express my appreciation for Mr. Chow, our advisor, who has helped us launch this club and is supporting us on many fronts. That's it for now, everyone, and see you at the next club meeting.